Have you ever paused while reaching for that familiar vitamin bottle in your cabinet and wondered if it's really helping, or quietly harming, your heart? For countless women over 60, a daily vitamin feels like a small act of self-care. It's meant to protect bones, support immunity, and give a sense of control over aging. But what if that trusted pill is placing a silent, invisible strain on your heart every single day? Most women don't realize that even vitamins marketed as heart-healthy, natural, or essential for aging gracefully can cause subtle, cumulative changes in the body. Changes your heart has to fight against quietly, for years, without sending any alarms. The first culprit is one you probably think of as a bone protector, vitamin D. While essential in the right doses, overuse, especially 5,000 IU, 10,000 IU, or more daily, can quietly overload your body. For women, whose kidneys may already be slowing with age, excess vitamin D can raise calcium levels in the blood. At first, nothing feels wrong. You may still feel energetic, maybe even notice stronger nails or fewer aches. But inside your arteries, calcium deposits can slowly build up, stiffening blood vessels and making your heart work harder to pump blood. Over months or years, this silent strain can contribute to higher blood pressure, unexpected fatigue, or a heartbeat that feels heavier and harder to maintain. In my years as a cardiac surgeon, I've seen women come into my care feeling exhausted after walking a flight of stairs, noticing occasional fluttering in their chest, or suddenly dealing with rising blood pressure. When we trace back the cause, it often isn't just lifestyle or age, it's the very supplements they've trusted to keep them healthy. And it doesn't stop there. When calcium levels rise too high, the heart's electrical rhythm, the very system that has kept you alive and active for decades, can become unstable. Skipped beats, fluttering sensations, and shortness of breath may appear, making you wonder if aging is finally catching up. These aren't exotic or dangerous chemicals. They're vitamins you see lining the shelves of every pharmacy, often taken without a second thought. And yet, in the right, or wrong, amount, they can quietly challenge the resilience of your heart. But aging isn't the real culprit. Overuse of a well-intentioned vitamin is. The question is, how many other trusted pills in your routine might carry similar hidden risks? Before we dive in, take a moment to reflect. Have you ever thought about the long-term effects of your supplements, or do you assume they're completely safe just because they're sold over the counter? The truly alarming part? Women often take vitamin D alongside other supplements, multivitamins, calcium tablets, or fortified drinks, without realizing the cumulative effect. It's like watering a plant too much. What starts as helpful can eventually overwhelm. Stay with me, because the next vitamin on this list, an antioxidant many women take daily, can quietly disrupt your heart rhythm in ways you would never expect. You'll want to hear this before reaching for your next capsule. Let's talk about a supplement almost every woman over 60 has taken at some point, vitamin E. It's marketed as an anti-aging antioxidant, a protector of skin, eyes, and immunity, but most women don't know this. High-dose vitamin E can interfere with the very electrical system that keeps your heart beating steadily. When vitamin E levels rise too high, especially above 400 IU daily, your blood becomes thinner. For some, that might sound like a good thing. But for a woman whose heart is already working harder with age, thinner blood means something else. Your heart must pump faster and stronger to maintain pressure. Some women describe it as a soft flutter behind the breastbone, others feel a sudden drop in the chest, and for many, it starts subtly, only during stress, or when climbing stairs, or while lying on the left side at night. In my practice, I've had women sit across from me describing symptoms they thought were harmless. "Doctor, I feel this tiny vibration in my chest sometimes. Is it normal for my heart to suddenly race for 3 to 4 seconds? I thought it was anxiety, but it keeps happening." When we trace it back, vitamin E is often the silent player in the background. At the cellular level, vitamin E affects how signals travel across heart cells. Your heartbeats aren't random, each contraction follows a precise electrical pattern, but too much vitamin E can disrupt the conductivity of these cells, causing skipped beats, premature beats, or short bursts of tachycardia. And here's the part that surprises most women: you don't even need extremely high doses for this to happen. If you're taking a multivitamin plus an additional vitamin E supplement plus fortified foods, your total intake can quietly double or triple without you realizing it. Picture your heart like a beautifully timed orchestra. Now imagine one instrument suddenly playing out of rhythm, not loudly enough to ruin the performance, but just enough to make you turn your head. That is what early vitamin E disruption feels like: subtle, easy to ignore, but impossible to unnotice once it begins. One of my patients, a 67-year-old woman who walked daily, began feeling a soft buzzing sensation in her chest every night before bed. She blamed stress, even dehydration, but when we checked her supplements, her vitamin E intake was nearly 3 times what her heart could comfortably handle. Within 2 weeks of stopping it, the buzzing vanished completely. Many women assume antioxidants are harmless, but the truth is, the heart is extremely sensitive to anything that changes blood thickness or electrical conduction, even natural vitamins. So if you're noticing random flutters, the unexplained quick thumps, pulses that feel slightly irregular, or brief moments of chest lightness and ignore them, your heart may be trying to whisper a warning before it ever shouts. Many women assume antioxidants are harmless, but the truth is, the heart is extremely sensitive to anything that changes blood thickness or electrical conduction, even natural vitamins. Stay with me, because the next supplement on the list is one women take for hair, skin, and nails, yet it can quietly strain the heart in a way almost no one talks about. You'll want to hear this before swallowing your next beauty capsule. Biotin, the popular beauty vitamin, is taken by countless women over 60 to support hair and nails, yet almost no one realizes how it can quietly distort medical tests that check heart health. High-dose biotin, especially the 5,000 to 10,000 micrograms capsules, interferes with lab machines, making heart markers appear normal even when the heart is under real strain. This creates a dangerous illusion of safety. A woman may feel heaviness in her chest, brief throat tightness, or strange arm fatigue, yet her blood work looks perfect. I've seen women reassured nothing is wrong, only to discover later that biotin was masking the warning signs their heart was trying to send. Symptoms get dismissed because the tests appear clean. Biotin can also hide thyroid problems, allowing low thyroid function to go unnoticed. And untreated hypothyroidism can slow the heart rate, raise cholesterol, cause ankle swelling, and quietly add workload to a heart already affected by age. Many women blame these issues on getting older, never imagining a beauty supplement is clouding their results. The scariest part is how easy it is to overlook. Women who believe their tests are accurate often push through symptoms, thinking they're fine. But if your labs are being distorted, how do you know when your heart is whispering an early warning? Fluttering at night, breathlessness out of nowhere, or heaviness after meals may signal more than stress, especially if you take biotin. Stay with me, because the next supplement, one almost every woman takes for strong bones, can quietly push your blood pressure higher and force your heart to work harder with every dose. Most women have no idea how easily this one becomes dangerous. Calcium supplements, especially the 600 mg to 1,200 mg tablets, are seen as a daily essential for women over 60. But when taken in pill form, calcium hits the bloodstream in a fast, concentrated surge your body isn't designed to handle all at once. Instead of slowly absorbing like food calcium, supplement calcium can overwhelm the arteries, making them stiffen and narrow over years. This sudden rise in calcium forces your blood vessels to tighten, which naturally pushes blood pressure higher. Many women describe it as a pressure wave they can't explain, like a tightening around the chest or neck, or a strange headache behind the eyes. And because the change is subtle, it's easy to think it's just stress, aging, or dehydration, until the symptoms begin repeating. What makes this supplement especially risky is how commonly it's paired with vitamin D. Together, they increase the amount of calcium moving through the bloodstream. For women whose kidneys are slower with age, this excess isn't filtered quickly enough. Over time, tiny calcium crystals can begin settling along artery walls, quietly increasing the heart's workload with every single beat. Some women report a heartbeat that feels heavier, or a pulse that suddenly becomes louder in their ears at night. Others feel breathlessness when climbing stairs, even though nothing else in their life has changed. These aren't random aging issues, they're signs the heart is pushing harder against stiffened vessels. And most women never connect it to a simple calcium pill. Stay with me, because the next supplement seems harmless, even soothing. Many women take it to calm the nerves, sleep better, or ease muscle tension. But in higher doses, it can quietly slow the heart's natural rhythm and leave you feeling foggy, weak, or suddenly lightheaded. What looks like relaxation may actually be your heart fighting to keep its pace. You'll want to hear this next one. Magnesium supplements are widely taken to relax muscles, improve sleep, and even calm the nervous system. Many women believe that because it's natural, it's completely safe. But in higher doses, especially 500 mg or more daily, magnesium can quietly slow the heart's electrical system. What starts as a gentle calming effect can tip into low heart rate, lightheadedness, or unusual fatigue, especially for women over 60. The danger lies in subtlety. You might feel a little weaker than usual or notice your pulse dropping during quiet moments. Sleep may become deep, but strangely heavy. For women taking medications for blood pressure, heart rhythm, or diuretics, magnesium can amplify these effects, creating a silent tug-of-war inside the body. Most women blame this on stress or age, never suspecting a supplement. Even worse, magnesium can mask early warning signs of heart problems. Occasional skipped beats, minor dizziness, or shortness of breath are often dismissed as normal. But for the aging heart, these signals matter. High magnesium combined with other minerals or vitamins can subtly suppress the heart's natural pace, forcing it to work harder without the woman realizing it, silently adding years of strain. I've seen women come into my care convinced everything was fine, only to find their supplement routine was quietly altering their heart rhythm. The key takeaway: supplements, even those marketed as calming or natural, are not risk-free. Women over 60 need careful guidance, monitoring, and awareness. What feels gentle on the surface may actually be stressing the most vital organ in your body. Next, we'll cover a supplement almost every woman keeps in her cabinet for immunity, the one that promises protection but can quietly fuel inflammation and blood clot risk in older adults. You might think it's safe, but the effects on your heart can be surprising and dangerous if taken without proper caution. Don't reach for that bottle just yet. Vitamin C is one of the most trusted supplements for women over 60. You take it to boost immunity, fight colds, and support overall health. But in high doses, 1,000 milligrams or more daily, it can quietly affect your heart. Excess vitamin C may increase oxalate levels in your bloodstream, subtly contributing to mineral buildup in arteries and forcing your heart to work harder over time. At first, you may feel nothing at all. The heart adapts silently while tiny mineral deposits form in the vessels. Blood pressure may rise gradually, and the heartbeat may start to feel heavier or irregular after physical activity. Women often attribute these shifts to stress, menopause, or age, never suspecting a vitamin designed to protect them could be the hidden cause. The danger is slow and silent. You might notice unusual fatigue walking across the house, brief shortness of breath, or palpitations that come and go. Lab tests often remain normal, giving a false sense of security. High-dose vitamin C doesn't attack the heart directly, it changes the environment inside your body, quietly forcing your heart to compensate day after day. Women who combine vitamin C with other antioxidants or multivitamins often push their intake far beyond what's safe without realizing it. Each extra pill increases the mineral load and the subtle stress on the cardiovascular system. Over months and years, this cumulative effect can quietly reduce resilience, leaving the heart vulnerable even when outwardly everything seems fine. The signs are easy to overlook. You may feel your pulse racing after small efforts, experience brief chest tightness, or notice swelling in your ankles. These symptoms are often dismissed as just aging. But in reality, they're the heart signaling extra strain caused by a supplement thought to be harmless. Many women only discover the connection after consulting a cardiologist. Awareness is key. A supplement can be beneficial, but dose, frequency, and interactions matter, especially for women over 60 whose bodies process nutrients differently than they did in their 40s or 50s. Understanding these hidden effects empowers you to make informed decisions, adjust intake, and protect your heart before subtle changes become serious issues. Next, we'll cover one of the most popular herbal supplements for energy and vitality, something women often take thinking it's natural and safe. But hidden stimulants inside it can push your heart rate too high, spike blood pressure, and quietly stress your cardiovascular system. You won't want to miss this warning before reaching for your natural energy booster. If you've followed every part of this journey, you now understand something most women over 60 are never told: supplements, even the gentle ones, can quietly shape the way your heart works. Not dramatically. Not suddenly. But slowly, silently, and consistently, until the signs become impossible to ignore. Awareness isn't meant to scare you. It's meant to protect you. You've learned how vitamins for bones, beauty, immunity, and energy can each carry hidden risks when taken in the wrong dose or combination. Not because they're bad, but because your body at 60, 70, or 80 processes them differently than it did decades ago. And that difference matters. It can be the line between a heart that thrives and one that struggles quietly in the background. The most heartbreaking stories I see come from women who did everything they thought was right, took vitamins, stayed active, followed trends, yet still faced frightening heart issues. Not because of age. Not because of genetics. But because no one warned them that supplements can interact, conflict, or overload the body when taken without guidance. Your heart has carried you through decades of stress, love, loss, and life. It deserves protection, smart protection. That means questioning labels, understanding doses, and knowing that natural does not mean risk-free. It means paying attention to your body's whispers before they turn into alarms. And above all, it means choosing your health with intention, not routine. So before you take your next pill, pause. Ask yourself what your heart truly needs. Is it another supplement, or clarity? Is it trend-driven advice, or real medical insight? You now have the knowledge millions of women never receive. Knowledge that can spare you years of hidden strain and empower you to make choices that genuinely serve your heart's long-term strength. The supplements themselves aren't villains. The danger lies in not knowing how they affect your unique body at this stage of life. And now that you do know, you have the power to protect yourself, to question, to adjust, to choose better. Your heart's future is no longer guesswork, it's something you can actively shape starting today. If you want to continue, I'll show you how to rebuild a heart-safe supplement routine step by step, what to keep, what to reduce, and what to avoid completely. Most women never receive this guidance, and it can change everything. Stay with me, because the next part could be the difference between a strained heart and a stronger future. Thank you for staying with me through this entire journey. Most women never hear the truth about supplements, because it's easier to sell a pill than explain how it works inside an aging body. But you chose to learn. You chose to understand. And that decision alone already puts you ahead of millions who take their daily vitamins without a second thought. Your heart isn't just an organ, it's the timeline of your life. Every beat holds your memories, your battles, your joys. Protecting it isn't just about avoiding danger. It's about honoring everything it has carried you through. The knowledge you've gained here allows you to finally make choices rooted in awareness, not habit or marketing. If any part of this series made you pause, question your routine, or rethink what you put into your body each morning, that moment of doubt was a gift. That pause could be the small shift that saves your heart years of silent strain. It only takes one new piece of awareness to prevent years of avoidable damage. But remember, this journey doesn't end here. Understanding risks is only the first step. What truly matters is what you do next, how you choose, how you adjust, how you protect yourself moving forward. Your heart deserves attention, curiosity, and care, especially now more than ever. So before you head back to your day, take one simple action: look at your supplement shelf. Not with fear, but with knowledge. Ask yourself what is essential, what is optional, and what might be quietly working against you. That single moment of awareness can change the future of your heart health. And if you want support along the way, you're not alone. I'll continue sharing guidance, uncovering hidden risks, and showing you how to build a heart-safe, age-smart supplement routine. You deserve information that empowers, not confuses, scares, or overwhelms. Thank you for choosing your heart today. If you want the next chapter, how to rebuild your supplement routine safely and confidently, stay with me. Your strongest, healthiest years are not behind you. With the right knowledge, they can still be ahead. And this is only the beginning.